Smith. My name is Taylor. I'll be your student nurse today. Could you please verify your name and date of birth? Alright. Do you have any allergies? Okay. Alright, on a scale of 1 to 10, 1 being the least amount of pain, 10 being the most amount of pain, what would yours be? Okay, depending on what the patient says, you would give them pain medication 30 minutes to an hour before. So what we're going to do now is we're going to do a dressing change. We're going to take your old dressing off and apply a new clean one. Now I'm going to pull the curtain around, wash my hands, and I'm going to put my red bag over here. Alright, now I'm going to raise the bed to working tight. I'm going to lower the side rail. Alright, and what I'm going to do now is apply my clean gloves. After I wash my hands, I'll apply my clean gloves. Just going to pull your blanket down. I'm going to take the dressing off towards the wound to prevent it from hurting. Get that. Dispose of that. I'm going to Alright, I'm going to inspect the dressing, the drainage. I'm going to assess the color, the amount, and if there's any odor. And then next I would assess the wound itself. I'm going to assess the color of the wound bed, the wound edges, the wound closure, and if there's any drainage present. Now what I'm going to do is take these gloves off and dispose of them in the trash. And then what I'm going to do next is prepare my sterile field, have my solution tape, everything's ready. I'm going to take it out away from me in the sides and then do the back first. I'm going to pour my solution, my wet gauze. Now I'm going to have an inch border around my sterile field that's not sterile. Make sure I don't touch the outside of it with my thumb on the inside. And then I'm going to pull this in. Make sure I touch the inside. And I can touch that. do first is with my wet gauze right here. Going to clean the inside of the wound first. Put that in my red bag. Then I'm going to clean the outer edge. Dispose that in my red bag. Then I'm going to clean the edge toward me. Dispose of that. And what I'm going to do now is measure the width, and then I'll put it on my thing right here. Then I'll measure the length. Here. And I'm going to measure the depth after I wet it, the end of it. And then I will measure that on my ruler and dispose of that. Next, what I will do is assess for any tunneling present, and there is none. Now, what I'm going to do is begin packing the wound. And make sure I squeeze out any excess solution. And that would be unsterile because it touched the skin, so I would take that out and get one of my other clean gauze, and I would make sure it's wet. And squeeze out the excess solution. Without touching the sides of the skin. And next I would get gauze, my dry gauze, and put on there. Then I would get my ABD pad and that on there. And now I would dispose of my sterile gloves because my sterile field is covered, or my sterile dressing is covered. What I'm going to do now is tape all four edges. and if there was any hair, we might have to shave it before we put that tape on. Alright, what I'm going to do now is cover it up, throw my trash away, or actually I'm going to do that last. I'm going to put clean gloves on, wash my hands, put clean gloves on, then I'm going to put these gloves on. And also, I would write the time, date, and my initials, and put that on the wound. And now I can throw my trash away. And I will take this out of the room, and as well as this, and take that out of the room and throw it away. Then I'll dispose of my clean gloves. And lastly, I would wash my hands and document the drainage of the wound, the amount, the color, and the odor. And then I would assess the wound itself, and I would assess the color of the wound bed, the wound edges, the wound closures, and if there was any drainage present. I would document that I cleaned the wound, and that I put the dressing on, and that the patient tolerated it as well. So I'm going to lower my bed and pull up the side rails.